Welcome back. It is National Prostate Cancer Month, a time to evaluate your own or your loved one's risk of getting the disease.
Dr. Christopher DeSimone with Arizona Oncology is here to explain what we need to know and talk about some new therapies and innovative tools. Doctor, great to have you here today.
Thank you.
So let's start out with just an overview of what prostate cancer is.
Well, the prostate cancer is actually the most common cancer in men. It's interesting because many patients who have the cancer don't need treated for it, and many people die from other causes and never need any treatment for their prostate cancer. It's a disease that requires careful evaluation because some people need treatment, others don't, and so that's been a big part of the field for many years, is trying to determine who needs treatment, who doesn't need treatment. So for people with early disease, which is oftentimes found by what's called a PSA test, for those people that are found by that test, oftentimes they have to make a decision whether they just want to watch it or if they want to receive radiation or have their prostate removed. So I generally end up treating a lot of patients who are with much more advanced disease. So people who disease has progressed over a number of years, or they just present with it with extensive disease. And those are oftentimes much more aggressive cancers.
And so is it genetic? What are the risk factors involved in
this? The biggest risk factor is age. The older you are, the bigger chance that you have it. And so, again, if you live long enough, you probably have it, but is it going to bother you or not is the question. So, but there are some genetic linkages. They're not that common, but there are some of the same genetic linkages that are common in breast cancer. So the BRCA genes. So there are people who, if you have a long history of prostate and breast cancer in your family, you should probably start considering genetic testing to see if there's something in your germline that's causing people in your family to get cancers.
What other preventative measures can we take, though?
There's really not that many preventative measures to be done to prevent yourself from getting prostate cancer. The one thing that does stimulate prostate cancer is testosterone, and that's a big part of the therapeutic options, is that we treat people by turning off their testosterone, and that can oftentimes put their disease in remission for long periods of time. So I'm not sure what's going to happen in the coming years. Certainly a lot of people are taking testosterone supplementation. I don't know if we clearly know what the effect of that's going to be. I certainly think if you do that, you need to be very carefully followed for prostate cancer. We do know, for instance, for women, that with the advent of getting rid of most estrogen supplementation, it was very common in the past for people to take postmenopausal estrogen. That's a rare thing nowadays, but that did lead to more breast cancer. And so when we got rid of that estrogen supplementation, a lot less breast cancer. So that's something certainly to be concerned about, is the sort of surge in testosterone use in men.
Yeah, and obviously, excuse me, obviously, starting this conversation is very important, and knowing the details about what to look for too. So talk about symptoms.
Well, the biggest symptoms people have are problems with urination. So they can have what we call dysuria, which just means their urination flow is not as good as they expect, or it's uncomfortable, so they notice changes. So that's when it's a good idea to go talk to your primary care or go see a urologist who can more carefully evaluate why you're having those problems.
Can it just slowly evolve over time, or is this something the onset is pretty fast?
Well, again, there's different flavors of prostate cancer. So there are some that are very slow to evolve. And for instance, in Europe, they've had a lot of patients just get observed, and they've shown that many of those people, it never becomes a problem. Again, I see that a lot of the patients who have the really aggressive prostate cancers, which can evolve from a very small amount of disease to basically metastatic, life-threatening disease in a short period of time.
And so Arizona Oncology specifically, talk about the treatments, talk about the breakthroughs and the unique approach that you take to treat it.
Right. So I've been doing prostate cancer for like about 20 years now, and so it's a field that has really evolved dramatically. We've come up with new medications to maximize what we call hormone suppression, and that's added life expectancy to people. We're using immunotherapy, we're using targeted therapies, we're using clinical trials, we're using chemotherapy. Just the number of tools that's evolved to treat the disease has really grown, and that's led to significant life expectancy increases for people that even have advanced disease.
And it must be really nice to see people come in and start responding to some of the treatments that you're giving them. Very hopeful.
Yeah, there's a lot of people who come in with, a lot of, low expectations. They're really concerned. They don't think they're going to do very well. And there's many things that we can do to really improve their quality of life fairly quickly, helping with their pain, improving their, so they don't have weight loss, things like that, so that they can at least have some quality of life.
Thank you so much, doctor. You're helping a lot of people. And if you, excuse me, Alex and I are in the same boat. If you'd like to learn more about prostate cancer awareness, you can check out ArizonaOncology.com, or you can call them at 520-886-0206.